Senator Roberts.
At the recent Senate estimates hearings, the NDIS Integrity Chief, Mr John Dardo, admirably confirmed that 90% of plan managers portrayed significant indicators of fraud. The level of fraud is now so high that there are dozens of examples of organised crime groups abusing the system, with millions of dollars being rorted. The system is so out of control that 87% of service providers are unregistered and unmonitored. Quoting Mr Dardo, "We have no idea of knowing what they do when they put in their invoices." Taxpayer money spent on something they have no idea of. He had the courage to admit that. He said that existing cases exceeded Australia's judicial capacity without finding more. Existing cases exceeded Australia's judicial capacity. NDIS funds must not be used to pay for sex workers, expensive holidays or new cars that other taxpayers cannot afford. Projections for a blowout of NDIS spending to $90 billion within a decade must be prevented. $90 billion. Using the system to peddle drugs is happening extensively. The name of this bill says what we already know about the NDIS. It's broken and getting worse. A licence for criminals and fraudsters to print money. It's so far off track that to hope this bill will get things back on track is a pigs can fly pipe dream. Since the Gillard Labor government's NDIS inception, there never has been a track. It was hatched with no meaningful metrics or plan, simply as an election slogan to desperately buy votes in an election the Prime Minister Gillard lost. It was hatched, as I said, as a headline grabber and a vote harvester. Typical of uniparty initiatives, policies and legislation in our parliament over recent decades, it lacks the discipline of a system based on hard data and focus on customers' needs. It was done to look good, not do good. A hastily cobbled-together election policy, it had holes in it a mile wide that clearly enabled fraudulent claims to be made with little chance of being picked up and stopped. As servants to the people of Queensland and Australia, Senator Pauline Hanson and I have been calling out the NDIS fraud model since 2016. A significant effort is needed now to remove dodgy plan managers and service providers and protect capable, honest plan managers and providers. Using stricter laws to prevent participants from being defrauded and prevent unscrupulous service providers from abusing vulnerable people. And to save NDIS for genuinely disabled people with real needs. If we really care, we'll clean up this mess. If we really care for disabled people, then we have to get tough on sorting out the criminals and the rorters. Providers, managers and recipients who commit fraud under this NDIS scheme must be heavily penalised and banned from any involvement in the scheme again. Wasted money through overspending is costing taxpayers well in excess of $8 billion already, and it's essential to ensure that the current 150,000 unregistered care or service providers become registered and then are monitored for effective compliance. The Gillard Labor government introduced NDIS. In their election loss, they handed the incoming Liberal coalition government an illegitimate, loose and sloppy mishmash of slogans and empty titles, lacking discipline and coherence, lacking focus, lacking care. If they'd cared, Labor would have put together a proper system, but they didn't. Lacking solid systems to provide effective care, systems to protect taxpayers' hard-earned money. The LNP tried to refine the monster, and now NDIS is back in Labor hands for more mismanagement. The NDIS must be reconsidered and protection from mismanagement and abuse strengthened. But who should be responsible for management? References to the non-constitutional National Cabinet are just a poor joke. National Cabinet is a mere grouping of state ministers responsible for similar portfolios, with no statutory authority or constitutional recognition of its existence or authority. It's toothless, all mouth and no accountability. There's no accountability in the current system. Right at the very top, the bogus National Cabinet, unconstitutional National Cabinet. What happens in such cabinets is the states and the federal government ministers just go, they're responsible. That means no one's responsible, no accountability. Fundamentally, structurally flawed. I suggest an inquiry should consider the alternative model, putting the responsibility for providing for the needs of people living with a disability back from where it was stolen, with the states and territories, clearly each state responsible. The states would work then to ensure that services are monitored, reasonable and meet client needs under a model reflecting the proven benefits of competitive federalism, the proven benefits of the foundation on which our Constitution and government is made, competitive federalism. This will provide the level of accountability that's been missing to date. Centralising doesn't work. Decentralising closer to the service does. One of the unintended consequences of Labor's mismanagement of NDIS funds is the shortage of aged care and healthcare workers who migrated to work in the lucrative NDIS model. This is because NDIS wages are so overinflated that a worker can receive 3 times the rate of pay for the same work if done in the other sectors. This is not just hurting NDIS, this rorting, this mismanagement, this waste of taxpayer funds. It's hurting aged care and healthcare workers. Labor wastes money in other areas too. Look at the wasted $430 million plus that the doomed referendum cost Australians. Like the Gillard's government NDIS facade based on slogans and empty promises lacking substance. Just think how that $430 million could have been spent directly to improve the lives of remote Australians living in need, or spent on improving NDIS service and security for people who are disabled in some way. And then there are the follies of government cutbacks when, as an example, psychological services were cut from 20 appointments to a relatively useless 10 appointments for needy participants. Just think what could have been done with the wasted monies. Health, education and child protection. Frontline staff are in short supply now, partly because of poor pay, inadequate training and lack of support, and partly because of NDIS rorts and sloppiness. Many NDIS carers and support staff have little or no training in basic personal caring skills. Many recipients have physical health needs, and their carers should have sound skills in lifting, mobility, feeding, toileting and showering. Expecting NDIS carers to do these things with no or inadequate training is unfair and dangerous for the recipient and the carer. I have described above a support system in crisis. This bill tinkers around the edges. As it is, this bill will not make significant positive differences. And who pays for all this waste? Always, it's we, the people. Instead of tinkering around the edges of a broken system, do the work. I call on the government to do the work to define disabled people's needs for service and taxpayers' needs for protection. Instead of ubiquitous fraud under low levels of accountability, consider returning to the original system of state governance. One nation knows what history repeatedly proves. Administration and services are of higher quality when services are closer to recipients. That enables understanding of needs, the core to effective service. Replacing centralisation with competitive federalism provides a marketplace in governance. A marketplace in governance. That's what we all want. That's what we need. Because improved governance provides accountability and effective service and better care.